So I'm so excited to have Dr. Isabelle Raymond, who is the Chief Science and Medical Advisor for Nutrafol. And we're going to dig deep, deep, deep into hair and hair loss. And as somebody in perimenopause who has lost a lot of hair, I really want to understand why. And I'm so excited that we're here and that you're here with us. And Dr. A is joining us from far and wide lands on Zoom. And usually when she's doing that, she's delivering a celebrity baby. We're not going to say that that's happening today, but it may or may not be. So,
Dr. Raymond, I'm so glad you're here.
Thank you for having me. It's very exciting to be here to talk about this because I think it's a topic that affects a lot of people, affects a lot of women.
Hair loss is an issue that all of us, I think 50% of women deal with hair loss in their lifetime. I definitely dealt with it when I had my double mastectomy. I started losing a lot of hair, I think because of menopause and the stress, the combination of the two. But there's so many different causes for hair loss. It could be genetic. Some people are more predisposed to hair loss than others.
I mean, Dr. A and I have hair loss for totally different reasons, but I don't know a single woman my age that hasn't been affected by it. Why do women lose their hair?
So we're all born with our hair follicles. What you get is what you get. It's in utero, and you are born with all the hair follicles you're ever going to get in your life. So you're never going to get more. So that's why we always say you want to take care of them because you're not growing anymore.
Like your eggs. Women are born
like
with a certain amount of eggs, some egg follicles.
Exactly. And so you're born with all your hair follicles, and that's what you're going to get. So you want to take care of them. Hair follicles, to understand how they can be affected, you have to understand the hair growth cycle. And I think just talking about that a little bit will be very helpful to understand. So basically there are three big phases of the hair growth cycle. You have your anagen cycle, which is the growth phase, and that usually lasts about 2 to 7 years. So that's a very long cycle where your hair grows, and it can grow very, very long. That's why, hair on your eyebrows doesn't have that same anagen growth cycle, and so it's never going to grow as much as the hair on your head. So hair on your head has about 2 to 7 years on average, and you have about 80 to 85% of your hair at that time in that phase. Right, so that's number one. Number two, your hair then moves into the catagen phase, which is a very short time. It's about 2 to 3 weeks, and that is the transition phase, right? So they're just kind of waiting a little bit. It's detaching from the bulb, and it's not receiving nutrients anymore, and it's transitioning into the telogen phase, which is going to be that rest phase that can last a few months. And then once it lasts a few months, then you start shedding your hair. So there's a normal cycle until you lose, your hair falls out and then a new hair grows. And so there's a lot of factors in your body that are going to affect that growth phase, how long you stay in it, how you can get out of it. So we really want to have things that will keep us in anagen phase. So estrogen, for example, is a hormone that helps us stay in anagen phase. Think about when you're pregnant.
Oh, you're right. It grows like crazy when you're pregnant.
You have more of your hair is going to be the anagen phase, and then after you give birth, for all the reasons of the hormone changes, the stress, etc., you will have then a telogen, a lot of hair switching into that telogen phase, which is why at the same time, which is why you feel like you're losing so much hair.
Because you do, right? Dr. A, like you, after you give birth, you see that a lot, don't you?
All the time. And usually, there's so many reasons why patients lose their hair. In my practice, correct me if I'm wrong, but testosterone gets converted to dihydrotestosterone, which is a more potent form of testosterone, which can actually cause thinning at the level of the hair follicle. It can also, some patients their follicles are more sensitive to these androgens. It's genetic. So that level of androgen causes more hair loss in them than it would with other patients. And also these androgen levels can disrupt the hair growth cycle, as she was describing. Basically, it shortens the growth cycle and it increases the resting cycle. So patients tend to shed more. But, stress, hormonal imbalance, nutritional deficiencies, and that's where I think Dr. Raymond is going to educate us on. A lot of us are low in a lot of these nutrients that help our hair growth. So it's a combination of things. It's not just one thing, but definitely as we get older, we start losing more and more hair.
So what do we do?
Well, the good news is there is something to do. And I think there used to be, this myth that you're genetically disposed to the pattern of loss that you're going to have based on your mother's father or whatever that is.
That's what I totally think. I have honestly thought that's an old wives' tale. So my son doesn't look at my father to see, because my dad has so much hair, like it just grows like a weed.
So there are genetics that are going to predispose you to Dr. A's point that you're going to have some follicles that are sensitive to that DHT, and the pattern on which that you're going to see that is based on genetics. But if we think about that hair cycle that I just mentioned, there are a lot of factors that can affect it, right? There's diet, there's nutrition, there's your gut microbiome, there's hormones, there's lifestyle, there's stress. There's all these things that we know are going to affect the cycle of hair. So if you're just attacking one with one drug, for example, or one type of treatment, then you're kind of missing out on everything else. So we really want to understand, part of what I loved about joining this company is that they looked at hair in a completely different way. It used to be, you're genetically predisposed, you take this, take some drugs that will affect mostly hormonal effects on the hair follicle, and that's what you do. But knowing that your lifestyle can affect your hair growth or improve your hair growth. So all these things, these are things you can do, right? So you can work on yourself and really take that whole body approach to improve your hair growth.
When I started losing my hair, when perimenopause happened, and I've always had so much hair, and then all of a sudden, same thing that you said, I was like, oh, my ponytail's half the size as it was. Now, you look at my hair and you think that woman has a lot of hair, but it was twice as much before. So for me, I thought to myself, well, I need to let me take some vitamins. What are the vitamins for hair? And it was Nutrafol. So can you talk about the product itself and why the company was started? And because I will say, from doing this podcast, Dr. A and I have learned, we've gotten under the hood a lot in the supplement industry. We try as much as possible to be very, very careful that the people that we have on this podcast, that the products that we talk about are backed by science. We want women to be armed with the knowledge and power to be their own health advocate. So, you wouldn't be sitting here if we didn't think that Nutrafol was backed by science. Can you talk about the clinical efficacy and what makes Nutrafol different?
So I came from a pharma background. I've been in the industry. I worked in dermatology, and I've done pharma, I've done lasers, I've done medical dermatology, I've done cosmetic dermatology. I launched one of the toxins. And so I'm used to working with products that have an FDA requirement to do certain studies. So when you put a drug through that pathway, you know exactly what you're supposed to do, the numbers of people, the outcomes, et cetera. When it comes to, so I came from that background, so supplements being kind of the Wild West, a little kooky sometimes, and the claims that are being made, it's I remember being at a conference and talking to the founders, and they said, would you join our company? And I was like, I don't know. And a lot of derms were skeptical. They're like, do you really want to do this? And it felt like I didn't feel as serious, right? And so I joined, and I just realized all the work they had done, and they were really one of the first ones to study the supplement, because you don't have to. Like, the pathway of supplements to go on the market is very different than one of a drug. And so not all companies will dedicate the energy, the time, and the money to study their product, either from the research standpoint or from the full formulation. So I think what makes this company so different is the fact that they are studying their full formulation, and they're formulating for women.
Yeah.
Secondly, which is women through different. So we have a women's supplement, we have a vegan supplement, we have a postpartum supplement, and we have a menopausal supplement. So we really think it, because we understand that women going through different life stages will have different root causes that are affecting them more at that time. And so not only did we develop these products, we studied them in the population. And to me, that really shows the dedication to commit, and the dedication to understanding the product and studying women, but also to show that the product works.
Yeah.
So to me, that's the credibility that we get, and that we publish them in peer-reviewed journals. And so to me, it's like it's a new frontier. It is exciting because we are bringing legitimacy to, I think, a field that doesn't always have it. And we're really proud to be those leaders. So people are aware that when this starts happening to them, they understand why, and they can do something about it. So in terms of research, I think in general, yes, men have been studied a lot more than women in medical literature, and that's true for a lot of different conditions. But I think for men, it's become very acceptable, even though it could be a little more difficult for them to, nobody wants to lose their hair. But I think there's a societal acceptance now that men can shave their hair, and so they have options. And there are drugs that were developed for hair loss and hair thinning in men. And it can be talked about. I think for women, the pattern is slightly different, right? And the reasonings are a little bit different too. Even though there are similar root causes between men and women, how it's affecting them can differ based on where they are in their lifestyle, life changes, and life cycles. And so as you notice that your ponytail is getting thinner, or you have to turn your elastic around 3 times instead of 2 I used to before. And so a lot of dermatologists may say, well, that's not a big deal. I mean, you still have hair, but you know your hair best, and you know if it's going to be thinning or not. And so just being able to bring that up in conversation and really study women to look at the improvements that they can get, even if it's not this official big loss that you would see in men, you still see some thinning. And so partner that with menopause that nobody wants to talk about.
Yeah.
So now you are going through perimenopause and your hair is thinning. You're just like, what is going on? So I think education in both of these, including menopause and also hair, to know that this can happen, and then having tools. I think to me the best thing we could do is educate women on this is what's going to happen. It could happen to you. Like not everyone will have hair thinning. We think results now are at 50%. I think maybe, eventually with age that does tend to change, but knowing what's going to happen to you, so it's not a huge surprise that it takes away the shame, it takes away the shock, it takes away the what do I do about this? Here are the tools. And I think the best we can do is offer that and also show clinically the results that it can bring you.
So what are some of the ingredients that are in the product that work for this?
Yeah, so they came out with a men and women formula.
Was it separate, men and women?
Men and women. And the reason that it was a little bit different, so the only difference between our men and our women's formula when it first came out was that there's more saw palmetto in our men's because of that. Saw palmetto is a known, it helps to inhibit the conversion of testosterone into the DHT, as we talked about earlier. And so men, since they have more androgenic predisposition, that was why they wanted to have more saw palmetto with that. But in terms of the ingredients, there's, I think, over 21 ingredients in this product. Really, we're talking about curcumin, ashwagandha, saw palmetto, tocotrienols, and a lot of other vitamins and minerals. But those are really the key ingredients that have been shown to improve either hair growth, that have been shown to combat stress. So all these things to really help improve hair growth. And then through time, we had dermatologists who were seeing women going through menopause saying, oh, let's take the men's version because there's more saw palmetto in it. So instead of saying, sure, let's take this product and just slap a label for menopause, they said, let's reformulate to add more ingredients to really help women through this transition, which was really great. So not only did we add more saw palmetto, but we also added maca. We added astaxanthin. So those 2 ingredients, so maca is known to help with hormone balance, and astaxanthin is an extra antioxidant. So it was really formulated for women going through that, which is really great.
I wanted to say that, but what also happens as women go through menopause is you get this decline in estrogen. And estrogen is very important for hair growth, right? It increases the growth phase of the hair. And as we go through menopause, we see a decline in it. So estrogen in general promotes hair growth. So the decline affects us during menopause. Genetic factors we talked about, but also as the estrogen levels go down, it can also affect the blood circulation around the follicles, which can also affect hair thinning. And so it's like a combination of things at different phases of life that needs to be addressed. But, Nutrafol, I think, we talk about the nutritional deficiencies, and that's the aspect of it that Nutrafol really covers, because you can do all these other things. If you're low in some of these ingredients, or if you're low in some of these supplements, you're not going to see the results that you want.
And you guys talk a lot about the holistic approach, which is a whole body health. Can you talk about that a little bit? And what do you recommend for a woman who has lost her hair in terms of diet?
I feel like when you go through menopause, you're thinking, okay, my estrogen is going to decrease, and the effects of that on your hair are so, it's not just to your point that we're losing now estrogen that's going to help with the hair growth and staying anagen and all of that, but you're not protected against the testosterone dominance that you have, and also lowering of progesterone. Progesterone is also a protector, and if you have your progesterone decrease, that's also going to cause more DHT. So it's the balance of the estrogen and androgens as you go through menopause is really going to affect your hair in so many different levels. And so understanding that, I remember that we're seeing this this graph, right, of like your normal monthly cycle of hormones before you enter menopause is very predictable. And then once you enter menopause, it's like a giant roller coaster of hormones all over the place. So you can imagine just how your hair follicle is just struggling to be able to get through it, because it's affected by the lack of estrogen, extra testosterone, conversion to DHT, and things that it's not been produced or not been exposed to before. So it's all changing. And because it takes a while for hair to be able to be affected by this, because again, the hair cycle is very long. It's not something you're going to see overnight. So it's important to know that this started probably, it's a long change. And so improvements are going to take a long time too, right? It's not going to happen overnight. So hair cycle is long. People, we usually tell people to expect any kind of improvement, whatever you do for your hair, to take 3 to 6 months to see improvement. And so knowing that your hair follicle is affected by hormones and menopause, I think there's specifically during menopause, I think now we're learning a lot more of all the things that are changing. And if we know that the gut microbiome is something that is very important for hair growth, knowing, I didn't know this until this past few weeks, that the gut microbiome during menopause completely changes. So if your gut microbiome is changing during menopause, it doesn't matter what nutrients you're taking, right? So you really have to think about the whole body approach, because we can say, take this and you're going to improve. But if you don't understand your microbiome's changing, then that's not going to be helpful. So you have to think about the whole body. Otherwise, you're going to try to put pieces of puzzles without looking at the whole picture.
So do you recommend a probiotic as well?
Yes, absolutely.
And do you guys have a probiotic?
We do.
So you kind of have everything you might need, from the scalp to the gut to the hair.
They thought about everything, and that's the great thing. They really thought about every possible lifestyle. Think about the pollution and toxins and all of that. So it's not just what you take in, it's like how you live your life. If you're a smoker, that can also affect your hair growth, right? Yeah. So it really is a matter of like thinking that I can do something about it, which is probably the message that I think is the most important, you're not genetically predisposed to.
You can do something
you
about
can
hair
do
loss.
Something about it, exactly.
Average age of menopause is 51 and a half. 7 to 10 years before menopause, women go through premenopause, and we actually do start experiencing hair loss even in premenopause. So you don't have to be absolutely menopausal to see that change in your hair. As the estrogen declines, our androgen levels go up. So estrogen is good for our hair. It brings blood circulation to the scalp, to the follicles. It causes hair growth. It increases the growth phase of our hair cycle. And so doing all that, it promotes hair growth. On the other hand, as estrogen levels go down and androgens go up, as we talked about, androgens can get converted to dihydrotestosterone or DHT, which is more potent. It can weaken the follicles. Then we start losing hair. Our hair gets thin. The blood circulation gets affected. Obviously, some genetic factors will play a role in that. So as estrogen goes down and androgens go up, we start losing hair. So a lot of these, like we talked about, nutrition is at the root cause of it. So you have to make sure all the supplements, your levels are all normal. So, taking vitamins and supplements at menopause are extremely important. I love Nutrafol. I'm not just saying this because you guys are here. I've recommended it to my patients. But estrogen replacement, hormone replacement for some patients who qualified for HRT, that estrogen can help with the circulation and with the hair growth. So that can make a difference. When you said talk about myths, is one of the myths I would say people think hair loss is only for men, that women don't get it. Your hair can grow overnight, that it's genetic. So if you don't have it in your family, you're not going to have any hair loss. And or like, I don't know, if you wear hats, you're going to lose hair. If you shampoo your hair more than twice a week, you're going to lose hair. A lot of these are just not true. And there's so many factors that can affect hair loss. But at the most important thing to address is, one, the nutritional supplements that we might be lacking. Two, whether or not there's this disruption in our hormones causing this. And obviously, stress is on top of the list. Having said that, you have to have a holistic view at hair loss and put a check mark in front of every single cause, because almost every single person has a combination of a lot of these factors causing their hair loss. if that makes sense. Any physical or emotional stress can prolong that, resting phase of the hair. So people tend to lose hair. When you're sick, if you're hospitalized, your nutrition gets affected, you're not exercising, you're not living a healthy life. And so it's a combination of emotional stress, physical stress, nutritional deficiencies, and hormonal changes.
Yeah, and also a divorce. My friend lost all of her hair during her divorce. She was so stressed out, and she lost all of her hair. I'm not kidding.
Any big stressful event. Yeah,
so
exactly.
It's stress, and it's sort of what you're saying. It's looking at it from a holistic view, and that it could be an illness, it could be a life experience, it could be menopause, it could be pregnancy. There's just all these reasons, and so to be able to take a supplement that sort of brings all of these, and you're armed with some of these nutrients that you didn't necessarily have in your diet.
Exactly. And it's really understanding. I think until before we were talking about just like a one, just looking at one reasoning behind hair loss or hair thinning, and now we're really thinking about the whole body's reacting. The whole body is helping or hindering hair growth, and so understanding that stress can affect it, nutrition can affect. So I think getting a panel to understand what am I deficient in first of all, because you don't want to take things that you don't really need. You know, especially as I go through menopause now, I'm taking so many supplements for all the other things that are going wrong. But I think for getting your panel to understand what vitamins you're deficient in. So it really is important to understand why you need to take certain supplements and why you need to not take other supplements. Right.
Well, all I have to say is that you have gorgeous hair.
Well, thank you.
So you're doing something right. So what do you think the biggest misconceptions about hair loss are that you've learned?
Oh, my goodness. That's such a great question. I think, for men specifically, that you are destined to have your father or your grandfather's hairline, that you can do something about it. And also, joining this company, really understanding the approach, and like you want to maintain what you have, you want to increase your hair potential, right? Because unless you know how to feed it. So I think it's important to look at all these different factors and how you can have the best hair possible and do something about it. I did not think I could do anything about my hair.
I want to ask you a few things about hair that I've always wondered, because when you think about hair, sometimes the scalp gets overlooked. And I think that I just went to the dermatologist because another amazing thing that happens in perimenopause, I started to get rosacea and flakiness on my forehead. And so we are having to work on my scalp and figuring out like how I make sure that my scalp is healthy. Does this also affect your scalp? And how do you keep your scalp healthy as well as your hair?
So we have other products for the scalp. So we have a line of shampoos and masks that are microbiome friendly, because we understand that scalp health is important for hair growth. So you can think about our supplements are more that internal support, and our topicals are more that scalp health, because you need both.
It's a double whammy.
Yes.
So is brushing it every night a bad thing, or is brushing it wet a bad thing? Like, what are some of the things? So you're a woman, you come in, your hair's like, tell me what diet I should be doing or what I should be avoiding. Tell me how I should brush my hair. We're going to assume that she's taking the Nutrafol. What are some of the just tips that you could give a woman right now who's struggling with this?
So I think wet hair is fragile. Wet hair is more fragile than dry hair. So, we usually say to, condition in the shower, brush in the shower and then let it be, Don't go to bed with your hair wet, anything that could damage it, because, and I think everyone's going to have different types of hair. Some people have more fragile hair. I have very, very fragile hair. I cannot chemically treat my hair because it doesn't do well. So it really is knowing your own hair and what you can do with it, being kind to it. Some people want to wash their hair every day, and I think that depends on the scalp, on the condition of your scalp. It's not bad to wash your hair every day if your scalp can take it. Other people should maybe wash every few days. I think conditioning is important too. So there's the hair, and there's also the scalp. And so we really try to address growth from within. So we're really talking about your whole body leading to the hair coming out of your head. And once that hair is out, then it's how do you treat it best. So I think the nutrients, the conditioning, the protection, and all the things you do, styling, the heat, et cetera, that can also damage. So try to do that in moderation as best you can.
Okay, and then what about food? Are there any things that you should avoid in terms of if you're losing your hair? Are there things that you should eat, or are there things that you shouldn't eat?
I think everyone's going to be a little bit different, right? It depends. I think there's your general. So I think anything that's going to affect your metabolism, because we know that metabolism is going to affect how your hair grows. And so if you are, glucose intolerant, or you have some issues with metabolism, which we tend to have when we get into menopause too, that all changes. So that can also affect hair growth. And so really having anti-inflammatory diet and things like that can also help.
I have a question, Dr. Raymond.
Sure.
Can you take your Nutrafol hair vitamin with other multivitamins during the day?
Yes. So again, I think we have to look at the amounts. We don't want to overstack, right, with other things. So usually, depending on the multivitamin that you take, there's just so many vitamins out there that you have to just make sure that you don't go with the upper limits based on what else you're taking. And I know there's so many different things out there. So I would say I like to say talk to your doctor.
And so what do you suggest for a woman who's again, so let's say that she's losing her hair and she's taking multivitamins. How does she decide if she should take Nutrafol?
My advice would be go talk to a board certified dermatologist, because they are the ones who are going to they're the experts in hair, and they're going to be able to ask questions, do a history that will maybe find other reasonings, right? You want to make sure that you eliminate any other medical condition that could be contributing to that. So I think a good history with a dermatologist is the first step I would suggest. And then they can understand, knowing that if anything else is eliminated, then they can make the right suggestions. Talking to, I go to a lot of conferences and work with a lot of dermatologists, and my understanding is like the approach to improving hair, they throw the kitchen sink at it. Once you've eliminated any other medical conditions that can contribute to hair loss, let's give it everything. And it's not just take a supplement. You can try, some people say it's a nice place to start, but it also should not negate using other modalities. And in office, they have a lot of modalities, and there's a lot of things you can do. There's a lot of over-the-counter things. There's lasers. There's so many things you can do. But then I think understanding the base of the nutrition and the whole body approach, because, hair, we like to say, is a reflection of your health. And so you could be doing all these things, but if you're not treating your body well, if you're not taking the nutrients you need, if you're not taking care of these root causes, the treatments may not be the best.
Right. Exactly. So again, holistic. Can we talk a little bit about why has it taken so long for menopause to be studied in terms of hair and just women's health in general? There is a huge gap in research. We know this, and if you listen to this podcast, you know this. But from your perspective, working at this company, who has actually spent the time to do the research on women, can you answer that?
Yeah, so I think you need women at the table who are going to make decisions that this is important. Historically, departments or, people who make these decisions didn't probably consider the importance of studying women and just assume that we can extrapolate from men's studies, et cetera. But I think understanding hair thinning in women is very different than men, not only because how it affects you psychologically, but also the potential root causes like we talked about, and also understanding through the different life stage. We invested money not only to test a supplement, but to study women. And then we studied women in menopause, and it turns out that we are the first in 2019 to publish a study on the results of a supplement for hair growth in menopausal women. We're the first and only. I would like to change that. I think we need to have more studies in women, to understand, because number one, what studies do is not only does it validate a woman's experience, not just, men go through this, so maybe you go through it too. Women, you see yourself in our studies. And I think that validates the experience, it validates the results, and also makes us a little more seen. So I think the importance of that to me became a lot more clear when we were at the NAMS meeting and there was a press release about it. This is the first study. And I was like, this is the first study? Are you serious? But at the same time, it's not surprising, because women's healthcare is not something that has been, think about the NIH budget for women's studies is very, very little compared to everything else. And most of it is spent on reproductive health. So I think it's a first step into really making sure that women are seen and understood, and the treatments or the anything that we do for women is tested in women.
Exactly.
So we know the results, and we don't just extrapolate from men.
We are not men with boobs. That's not what we are. So let's just make that clear. Okay, amazing. Well, this is so interesting. I'm telling you. I mean, I'm just speaking as somebody who has literally lost a lot of hair, and I kind of didn't know what to do. And the thought is, all of a sudden you wake up and you're just, whether it's right after you've had a baby or, in menopause. So I think this has been so helpful.
I think we know a lot. I think I've always known if I was going to have a baby that I would lose hair afterwards. I think that was a no, but for menopause, it was very surprising. And I had no idea. And I think just understanding that it can happen is a good tool to know that you can do something about it. So again, education is very important.
I just honestly want to thank you guys for the work that you're doing in the research for women. And let's close this gender gap and let's create products that are built for us and made for us and studied on us. So thank you, Nutrafol. And thank you, Dr. Isabelle Raymond, for being here.
My pleasure. Thank you for having me.
Thank you so much.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.